Hello, hello. Can you hear me? Testing, testing. Welcome, welcome. How's everybody doing today? Welcome, everybody. Can you guys hear me? Can you guys hear me okay? If you guys can, just put in, type in yes in the chat. How's everybody doing tonight? see. So, anybody who's in the chat, welcome. This is a more of a Q&A. If you have any questions, feel free to ask. This is actually my first live stream, so welcome to the chat. Anything about nursing you may ask, or feel free. Welcome to the chat, everybody. Let's see. I'm thinking about going live on Instagram too. Going live on Instagram. Excuse me, I'll be right back. There's like no. Oh wow. First time going live on Instagram. What's up? But now you're telling your followers that you started live. Oh, that's what's up. Okay. Oh wow, look at that. We got some people in here. That's what's up. Let me let me increase the light on this. How do you do this? Ooh, there we go. Nice. Welcome everybody. How's everybody doing tonight? I'm also live on YouTube as well, so we got that going. This is my first Instagram live, so welcome everybody. I'm also live on YouTube. I'll show you my YouTube screen. Yeah, there you go. Also live on YouTube, everybody. Who in here is in the nursing field? Type yes in the chat. Oh, okay. Nice. How's that going, Eloy? How's pharmacology going? Talk to me about that. What's we doing this live? Let's see. Oh, okay. Are you in a program where it's accelerated? Is it like an accelerated program? Sorry, I'm just like working out, trying to see how. I've never really done Instagram live before, so this is interesting. Oh, okay. Carla, how's it going? Welcome to the chat. Okay, I'm trying to play around with it. All right, that should be good. Oh, okay, we got a couple people in here. Everybody saw me. So I am streaming live on Instagram and YouTube right now. So for those of you who are new, welcome to the chat. This is actually my first time streaming on both platforms, YouTube and Instagram. So it's definitely an experience. Let's see how it goes tonight. See, everybody, I'm streaming on YouTube as well. That's pretty cool. No, just taking it as practice and watching you on YouTube as well. Okay, great. Yeah, if you, well, thank you for the support, first off. I appreciate that. And for those of you who are new, welcome. My name is Tribe Nursing. I do lectures, vlogs, and study tip videos on my YouTube channel. I started this YouTube channel about a year ago, and ever since then, I have just been, slowly progressing and moving more into the nursing space, the cyberspace. It's interesting, but as far as just taking it as practice and watching you on YouTube as well. Okay, as practice. Yeah. So if you, I do a series. I'm going to be doing a series on pharmacology as well. I have a whole lot of different series I have coming up soon on my channel, but mainly I do patho, a lot of patho, but I'm actually in the process of creating study cards, study note cards. I have, I am notorious for making note cards throughout nursing school, so I'm actually in the process of developing those note cards into digital note cards. So I have pharmacology cards coming soon as well. YouTube, how's everybody going? Welcome everybody. Welcome to the chat. So I've been streaming on YouTube for 20 minutes now. I have a couple people in live Instagram live stream. Just that I got the one person in. Let's just keep it going. Let's just see how it goes tonight. Just trying to. All right, we got 3 people in YouTube. We got another person in. Hey everybody, how's everybody doing? How's everyone doing tonight? Welcome to the chat. We got 4 people in YouTube. Okay, all right. Everybody who's logging in onto the YouTube live stream, I'm doing a Q&A for all nursing, or just if you have any questions in general, feel free to ask. This is actually my first live stream, so oh my God, thank you for telling me that. I've been speaking this entire time. I'm not sure, Aloy, did you hear me talk about the pharmacology note cards? Oh boy. See, I'm telling you, I'm new in the whole Instagram Instagram live. Okay, great. Sounds good. But yeah, if you have any questions, or as a matter of fact, I do tutoring as well. I offer free tutoring services. So if you or any friends are struggling in, who need, not really struggling, but if you want some tips on nursing or some nursing topics, feel free to ask me, and I can give you that. I can give you a free tutoring service on the house. That's awesome. So we just got the one person on the Instagram live. We got 2 people on YouTube. My YouTube chat's kind of dry in here. No one's really talking. Everyone's just kind of chilling. Okay, there we go. We got our first comment on YouTube. Charlie, hey man, I just started nursing school this summer. I just completed concepts 1200 for the month of June, and I start 1202 the next week. Okay, so that is the course number. Okay. How Okay, first question for you, Charlie. How was concepts? Tell me about concepts. And what class is 1202? For those of you who are in the YouTube live, I'm also on Instagram live as well. So I'll be going back and forth on both. So don't be confused if I'm, looking on my right side and talking. So I'm going to answer some Instagram questions now too. I'm not in the nursing program yet, but I do need 2 more classes to get into the program. Okay, there you go. You just gotta take it one day at a time. You'll get there, Aloy. You'll get there. But if you do ever need, if you do need any type of nurses, if you have any nursing school related questions, you know who to ask. I'm hoping to grow the channel in the future, so let me know if you have any questions. I got you. All right. We started with learning QSEN, nursing process, hand hygiene, vital signs, physical assessments, medication, math. We also did mobility and sleeping. Oh, okay, nice. So that sounds like it's just like, so it was just your first pretty much first couple classes. Okay. The basics. So Charlie, you're just getting to the basics for now. That's pretty good though. Charlie, and nursing school is gonna fly by. So don't ever feel like it's like going to, it's crazy because I remember when I first started nursing school, I couldn't believe how fast it went by. So just honestly, my biggest tip for you, Charlie, just take it one day at a time, and before you know it, you're gonna be done. It's crazy how fast it flew by. I honestly felt like yesterday that I just started the program, and now I'm a full-on registered nurse now. So, Charlie, if you have any questions, feel free to ask. Anything about nursing, anything in general. I'm your guy. I'm your go-to guy. And thank you for showing some support on the channel. I really do appreciate that. I've been watching your videos before I started nursing school, and I really like watching your videos. Please post more because I will watch all your. Oh, thank you. Wow, that's that's so nice of you. I appreciate that, Charlie. I will be posting as many as I can. Charlie, let me ask you a question though. First question is, when I post videos on YouTube, do you get alerts? That's my first question. And hold on, I'm gonna go back to Instagram Live and answer some questions there. How do I get into the one-on-one tutor? Aloy, it's pretty much the way to do that. So I offer a website. My website is www.tribenursing.com. Here's the thing. It's like, I do offer free nursing tutoring services. In order to get the free nursing tutoring service, it's really simple. Just pretty much, since I'm trying to spread the word of my channel, I am in order to get a free one-on-one tutoring session, it's just posting just sharing my channel, just sharing my channel on Instagram, on your story, something like that, and just tag me in it, and then you're just eligible for the free nursing tutor, and then everything is through Zoom. So you can send me your Zoom information, and then we can Zoom one-on-one. So I usually offer, as a matter of fact, if you go to www.tribenursing.com, typically these tutoring services are you would have to pay for. Like I think like a 1 hour session is like $20, 3 hour session is $55 or something like that. But there's the way you could get into a free tutoring service is just sharing my channel on your Instagram or on your or however, just as long as you tag me in it that you've shared my channel, you're eligible for a free tutoring session. So yeah, it's pretty easy. So you don't really have to pay. You just got to share my channel, because I'm just trying to, since like my channel is still a baby. It's 1 year old, as a matter of fact. I have my channel's been on live. My channel's been on YouTube for about a year now. I have about 2,700 subscribers now. I've been working extremely hard on gaining those subscribers. So as a matter of fact, like I don't even care about the money. It's like the money's not even a big thing. But if you just simply share my my YouTube channel and put it on your Instagram story, or you just put it and just tag me in it, you can get a free tutoring session, and we can set up a time on when to do that. Because I don't really care about the money. I mean, it's not, the money is whatever. I'm just trying to grow the channel pretty much. That's pretty much the whole purpose. Let's see. No, I don't, but I'm not subscribed to a lot of people, so I always see your videos on recommendations, and I like the advice you give on sometimes while I'm taking a study break. I'll check your videos out. Oh, okay, that's so awesome. Comfort care. Comfort, caring, culture, and diversity, sexuality, tissue integrity, wound care, development day, medication, pharmacology. Do you have any advice about studying for these topics? Okay. I have, oh yeah, for sure. Let me say, I can give you a lot of advice on a lot of those topics, 110%. Tissue integrity, wound care, that seems like more fundamentals. Like you learned it in fundamentals. I am a med-surg nurse, so I deal with a lot of wound care, a lot of wound care. A lot of my patients, they come in with wounds, and you need to know how to care for those wounds, and you're not, keep in mind that you're not going to be an expert by the time you leave nursing school on wound care, because honestly, I learned more about wound care in the nursing field itself. So as far as like, there's different types of wounds. There's the partial, there's the full thickness, all that stuff, right? So honestly, there's like the big concept behind that. Understand what tunneling is, and understand what undermining is, because you actually do see that stuff. You actually do see tunneling in a really bad wound. As far as understanding it, you want to understand like the big four concepts behind it. It's like the, partial thickness, full thickness, the deep tissue injury. Welcome Instagram. Welcome. How's everybody doing tonight? You want to understand those concepts, like mainly, because that's the stuff you're gonna be seeing a lot in the hospital. Let's see. Medication administration. Know your 5 rights. Right patient, right drug, right route, right dose, right time. Remember those 5 concepts. Erica, welcome to the chat. Instagram, how's everybody doing tonight? Queen of the Fall. Instagram, how's everybody doing? Welcome to the chat. I'm also live on YouTube as well. So if you are new, this is actually my first Instagram live, so welcome. Let's see, pharmacology. Oh man, how do I? Pharmacology, as a matter of fact, I would say the best way to understand pharmacology, I really want to do a series just on pharmacology. Like, I wish I can share my screen, because I would show you my digital note cards. I design digital note cards for pharmacology, and I am hoping to put that on my my Etsy shop pretty soon. So as far as pharmacology, you really need to know the mechanism of action, what the use is, what the medication is used for, and pretty much just like understanding like pretty much you need to understand like the mechanism of action the most, like what that medication does specifically, what and how it's going to affect your patient. Also you want to know like the side effects of certain medications, like in the nursing field, you're typically administrating like a lot of heart meds. So I would say dive really deep into those heart meds, dive deep into the different types of diuretics, because you do see that in the nursing field as well. Oh, hey Jocelyn, how's it going? That's so funny. I mean, I will be doing a series on pharmacology as well. I'm pretty much finishing up my my digital note cards, and I'm going to be making a series on just pharmacology, and I'm going to be putting those pharmacology note cards on my Etsy shop. So hopefully it's not, hopefully by the time I do that, you'll be good in pharmacology. Nice hat. Thanks, Juju. I appreciate it. So I'm pretty much trying to so this is pretty much my first Instagram live. Oh, Aloy, my Etsy shop. If you go on www.tribenursing.com and you just scroll down, you'll see a link for study guides. Just click on the study guides link, and here, let me write it in. Let's write it in. www.tribenursing.com. Scroll down. When you see, all you got to do is pretty much scroll down on my website. Here, I'll just show it to you. I'll just show it to you now. So this is pretty much. I'm live streaming right now. Let's see. tribenursing.com. So this is my website. So if you scroll down a little bit, you're going to see this right here, effective study guides. What you're going to do is pretty much type it. You're just going to click on this link where it says study guides. Click on it, and it's going to take you directly to my Etsy shop. And then, yeah, from there you can pretty much look up a lot of my stuff. So I mean, the ones I would suggest for you, Aloy, because you're going into since you're going into the nursing program, I suggest my head to toe study guide. My head to toe study guide, it's really effective, and it's actually on sale right now. I usually sell it for $20, but it's on $13.99. And then after you graduate, or if you want a study guide just for the heck of it for your NCLEX and your nursing school, I also offer the NCLEX study guide, and that offers a lot of things that you can, that you'll see on the NCLEX, and like types of concepts that you'll see on NCLEX. It took me a long time to design all these. So, yeah, these are the shops I went on. I'm sorry, this is my reviews, all 5 stars. So yeah. Okay. Do you have any advice about studying for the? Okay. So Charlie. So after my first exam in 12, I scored a 40 out of 55, and I studied really hard and I had a good sleep. I was really scared I would fail. My second exam, I scored 48 out of 55. I'm really trying my best right now. I have a lot of money invested into my nursing program, and I just want to not so you don't want to fail. Okay. I mean, yeah, that's. I mean, you know what? Okay, let's see where you're at. 40 out of 55. Let's see. So in the class right now, what are you, Charlie? What do you have in the class right now? Okay, 176 over 189. I would calculate that myself, but hold on, let me see. Let me grab a calculator. Let me go on Google Calculator. '88. Oh, you're doing solid. That's awesome. You're doing really good. Those are my classroom points in my clinical. Oh, that's really good. Okay, so let me ask you. So that's the 88% right now. In your program, what is the cutoff that's considered a fail? What's considered a fail in your program? Like, what's the grade that you need to maintain? The percentage, I should say. What is 1202? Is that what class exactly is that? Are those all the classes that you listed? Oh, 74 to 75%. And then how many more exams do you have left? Yeah, it's all those classes I listed. We only have 2 exams per section for the summer portion. Okay. Oh, okay. We only have 2 exams per section for the summer portion. Oh, wow. That's interesting. Okay, so pretty much it's all those classes that you listed. So it's considered a fast-paced program. Okay. I also start again in the fall where we are assigned to hospitals for clinicals instead of our simulation. Yeah. Okay. Yeah. For sure. Yeah. So it's pretty much you're in the beginning. You're in the brink of nursing school. At the start of it. So that's my first exam. 12 high school. Okay. Yeah. So once you start taking patho and pharmacology, are you in pathophysiology right now or not yet? I know you take pharmacology next, right, in 1202. So pretty much keep on watching my videos. I pretty much I really go into depth on those topics. Pharmacology, if I'll start making pharmacology videos specifically because based off my note cards, they just follow pharmacology concepts. So I can just simply do that. That's it'll be really easy to make those type of videos anyways. So I'll start doing that. And Charlie, if you need any tutoring, just let me know. Are you following me on Instagram? If make sure to follow me on Instagram if you want that free tutoring session, so I can give you to it. I look up your 2 videos and I look. Oh yeah, for sure. I mean, from male nurses supporting male nurses, for sure. You gotta definitely, we gotta stick with one another for sure. Instagram is just it's Tribe Nursing. Just look up Tribe Nursing on Instagram and you'll find it. And then if you need a one-on-one tutoring, I can help you out. Pharmacology is too much for a fast-paced. Yeah, pharmacology is a lot for a fast-paced class. I agree. So Charlie, I'm on Instagram too, and someone actually said that pharmacology is a lot for a fast-paced class. And I'm gonna have to agree with her. I remember I took pharmacology for like 16. It was a 16-week course in my school, and just like, but my professor, I had a really good professor who drilled the material in my head. So wow, that is crazy. A 6-week course of pharmacology. I can't imagine that. A 6-week class. Jeez. That's intense. That's really intense. Pharmacology, I don't know how you can learn pharmacology in 6 weeks. That's crazy. Even till this day, I'm still learning pharmacology. And I'm and I'm a full nurse right now. So it's like I don't know. That's crazy to me. But you can do it. I just like understand the basic concepts of it. Like understand the basic concepts of pharmacology and like just and I can make a video on it because I made a video on how to pass patho. I can make a video on how to pass pharmacology as well. Sounds good. Yeah, for sure. Aloy, just let me know. I got you. I'll easily break down how to study for your pharmacology classes. Simple. You too, Charlie. If you want, just let me know if you want that one-on-one. If you want that one-on-one, I got you. I can spend an hour with you over I can spend an hour with you with a free tutoring session. No problem. You too, Aloy. I can do a free tutoring session for you too. Just that's no problem. Charlie, thank you for the follow. I appreciate it. Let's see. Charlie, what kind of nurse do you want to be? What type of specialty do you want to get into? Tomorrow. Aloy, what kind of tutoring do you need right now? For what exact class? Well, I really want to be a nurse. I really want to be a nurse anesthetist, but that's a long way. I know I have to go to school for that and get my master's. Yeah, Charlie, that's really good. That's awesome that you want to become a nurse anesthetist. That's really good. Yeah, just like I said, just stick to, um, stick to the game plan pretty much. Stick to the game plan. I hope to work possibly in the ICU to get experience so I can develop critical thinking skills. Critical care, especially, yeah, critical. Yeah, in order to become a nurse anesthetist, you need like at least like 2 to 3 years of ICU experience first, and then you can apply into the nurse anesthetist program. Okay, yeah, for sure. Aloy, just send me. Let's see. How do I? Hold on, let me go. Let me activate. Let me go on Zoom really quick. I haven't used Zoom in a long time. Let me see how it works. I think I just got to send a code, right? Let me see. Join a meeting. Okay. Yeah, that's fine for my. Okay, there it is. Okay, so yeah, I have my Zoom. My Zoom is fine. Let me just X out of this. Leave the meeting. Aloy, even if you want to do it tonight, since I'm already up here, let me know. I can do the I can pretty much give you a quick breakdown of exactly how to study for pharmacology. Since we're already awake, we can definitely do it tonight. Just like a quick half hour, an hour. It's up to you. I can give you the exact key points on how to study for your exam. I'll tell you how I studied. What do you think? If not, I can try to do it tomorrow too. We can try to do it tomorrow. Just make sure to DM me on Instagram. Let's see. Yeah, critical care is good. I mean, that's that's what I want to get into too as well. Is critical care. So pretty much, yeah. I mean, I want to get into the emergency room. Hopefully, oh, got you, Aloy. Yeah, no problem. Yeah, I'm free tomorrow. Just DM me tonight. We can set up a time for a free tutoring session. That's fine. Yeah, especially like even I can even do like I don't know if you guys see the whiteboard, Charlie, the whiteboard right here, and then Eloy, you can see the whiteboard behind me. The whiteboard, I could even work stuff out on there as well for you guys. I can do math. Yeah, I can do the critical dosing calculations. I can go through pharmacology, pathophysiology. I can explain pretty much anything that you need me to explain. I can explain it for you. I can explain how things happen, why it happens, things you need to look out for. Just let me know. So I've been live streaming for about an hour now on YouTube, about 50 minutes. So I have about 3 other people. It's interesting because I have 3 other people in here. How's everybody else doing in the chat? Sounds good. Thank you, Aloy. Thank you for joining the chat. And yeah, just let me know. Just DM me later on and we can set something up for tomorrow. Charlie, of course. Thank you for joining. Definitely go get some rest and go get some sleep. Yeah, just reach out to me on Instagram, and of course, I got you, man. If you need any help, just let me know. I'm I'm here for you. Have a good night, Charlie. Take care. Let's see. Doo-doo-doo. All right, everybody. Thank you for joining the live stream. I appreciate it. It has been an hour now. I answered a few questions. Hopefully, within the next live, we can definitely answer more questions that you all may have. And with all that being said, thank you for watching. Have a great evening. My name is Trav Nursing. I create lectures and nursing vlogs. And with all that being said, peace.